Surgeons of Reddit, how do humans smell on the inside? Mostly you smell the metallic scent of blood and burning flesh from the electric cautery. The smell from cutting bone is the same smell as the dentist's office when they're drilling teeth, only 1000x more potent. The smell of a perforated bowel is worse than Satan's anus. Surgeon here. People do not have any distinct smell at first cut. If you violate their bowel, it will smell like fecal material as you would expect. Moreover, when you use the bovie cautery system, that burns the flesh soft tissue, which is a pretty awful smell. This is ameliorated by using the suction to get rid of the bovie smoke. The different tissue layers burn differently as well and depends if you are using coag versus cut on the bovie. You may also use bipolar, frequently seen in smaller procedures, incisions like hand cases. If you violate their bowel, eesh. If it's anything like a dog or cat, veterinary, the bowels have a bad odor. Necrotic bowels are terrible smelling, mainly metallic in a way that informs your brain this is a bad place. Leave. Also, cauterizing in animals smells like burnt hair and burnt garlic. Cauterizing patients just makes me feel hungry. Not a surgeon, but a paramedic who's been an observer of many surgeries. People are meat and fresh meat doesn't smell. However, if you puncture a bowel, that smells horrendous. In the early 70s I worked in housekeeping in a hospital surgical suite. The blood always reminded me of the smell of pennies in your hands. The worst job to clean up was a dropped glass suction jar after a bowel surgery. I've been present for many surgeries. The oddest smell in the world is when they cauterize flesh to stop bleeding. It kind of smells like a campfire burnt marshmallow. Same thing happens when they saw bone. It kinda smells like the drill at the dentist. Inhaling aerosolized bone sounds like a good way to pick up prion protein disease. Totally depends on the surgery situation. If I'm debriding Fernier's gangrene, I've got loads of peppermint oil on my mask to keep from smelling the horrible stench of rotten flesh and abscess. Abdominal surgery doesn't have much of a smell. I agree that blood does have a scent, but I guess I have stopped noticing it. When I am resecting an enlarged prostate, I use continuous irrigation to be able to see what I'm doing, so the gas made from the cauterization collects in the dome of the bladder. When I drain the bladder and release that air bubble, it's a really concentrated smell of burnt flesh, like a steak left on the grill too long. Surgeon here. Besides the obvious answers, blood smells metallic, bowel contents smell like poop. I have always noted a faintly sour smell when you open a belly or other body cavity. It's not a bad smell, necessarily, but it's distinct. Burning tissue, especially muscle, can get pretty smoky smelly when operating, which is why I like to use a smoke evacuator on some bigger cases. As with most answers looking for specific people, I am not that specific person. People would die if I operated on them. However, I was present when my wife had a C-section, and when they cut her open and pulled my son out, it smelled metallic. It was weird. Reminded me of pennies or something. Maybe it was the sterilizing junk they spray on before cutting it, but the smell was tinny. That's the smell of blood, and there's a lot of it involved in childbirth. My guess is you were smelling blood exposed to oxygen. Orthopedic surgeon. Most of these answers I'm seeing are right. That being said, most of the smells in the aura are pretty distinct for me from outside smells. Blood can smell different depending on how old coagulated it is. Fresh blood smells like it does on the outside. Dried clotted blood smells different to me and can be pretty bad. Bovied or electrocauteried muscle smells like grilled meat, and the hungrier I am the more that seems to be the case. Bone smells like calcium pills, drywall, and fat mixed together when we saw through it. Sorta unrelated, I love the smell of bone cement. I used to assist with veterinary surgeries. The smell of a foreign body surgery, when an animal swallows an impassable object and you have to basically dig through their GI tract to retrieve it, is ungodly and forever seared into my brain. That smell permeated everything. I could taste it. Oh hey, I don't work on people, but I can confirm that poop smells the same on the inside as it does on the outside of animals. Vomit also smells the same as what's in the stomach. Lots of metallic smells from blood. The liver and spleen have a really potent blood smell. Bone dust from sawing smells weird. Very much like what you smell at the dentist, but more burnt, I guess. Not a surgeon, but when my first son was born he had to come out via emergency cesarean. My wife was under a general anesthetic. I can tell you that it literally smelled like a butcher shop in the operating room. You know the distinctive raw meat smell? OMFSMD dentist. I've been through a lot of medical education and I've pretty much smelled everything from head to toe, inside and out. Bone smells like drilling a tooth filling without proper irrigation or suction. Cauterized flesh smells like barbecue, makes me hungrier when I'm hungry. Perfed bowel smells like poop. Fernia's gangrene is rotting flesh with the testicles hanging out, or in the thigh. Bloody poop. Melina. Heavy metallic poop. Rotting foot, athlete's foot on steroids. Old deep space and submandibular abscesses from tooth infection smell like bad breath with poop. The older, the worse it smells. The worst to me are labor smells when I delivered babies in MD school. I can't tell if it's a baby coming out or poop. I used to do taxidermy. Animals of course, not humans. Can confirm that you do not want to needlessly perforate bowels intestines because it is a smell like the sewage pits of heck. Blood has a coppery and metallic smell. Anyone who menstruates probably has an inkling of what I mean. I'm currently having one of my worst periods ever, and so is my dog. My entire room smells like blood. Dentist here. 1. Your breath sometimes smells terrible. If it's really bad, I ask patients to swish with mouthwash to remove excess bacteria before the procedure. 2. If I miss lunch, the metallic smell of blood from an extraction hits me hard. I can smell it 3 feet away and it is nasty. 90% of the time I smell nothing though. My friend is a nurse. She did a stint in school in an operating room. She said tumors smelled like something that's not supposed to be there. Med student here. When I first dissected a corpse it wasn't a smell I was familiar with. Couldn't place it. After some thought I would say it made me think of rotting fruit but stronger. Not a surgeon, but a funeral director who embalms. Freshly dead human does not have an odor, but sometimes the blood has a stale smell. Hard to explain. The bowels have some nasty odors to them, however, and aspirating can make those odors come out and leave the whole room smelling like pee and farts, but that's another story. Decomposing human, however, is foul smelling. It's unlike any other smell, so again it's difficult to explain, but the closest things would be a combo of rotting meat, something sweet, and BO all at once. Perforated bowels smell like a porter shitter on a really hot day, like porter shitter for 30 Marines that get cleaned once a month in 110 Afghanistan sun. Observed many surgeries and scrubbed in on a few dozen. The smell of blood flow on a laparotomy is the usual coppery tang you smell at a butcher shop or on a battlefield with multiple casualties. The fat smell from the electrocautery is sort of like generic burning smell, nothing remotely appetizing. Have also assisted in an autopsy on a decomp case, but you definitely don't want to know about those smells. I wanna know about decomp smells. Goo surgeon here. The worst smell is when you're doing a transurethral resection of the prostate and you let out all vapor from the coagulation smoke. It smells like you'd think it'd smell, but worse. So much worse. Transurethral resection of the prostate. Oh no. You take that image back, right now. For the most part, you don't smell much. When you use a cauterizer, you smell burnt flesh. If the bowel opens up, it smells like fecal material. Blood does give off a metallic smell because of the iron, think pennies. They don't really, unless there's an infection or spillage of intestinal contents, at which point it is indescribably bad odor. Usually you have your mask on, but a few smells that can get you are C-sections, gush of blood and amniotic fluid when you get into the uterus, electrocautery body for cutting or controlling bleeding, human flesh being seared, basically, and opening bowels for repair resection. Draining a large abscess in the operating room can also be one of the worst things ever. Otherwise the smell isn't too noticeable. Muscles and fat and connective tissue are fine. You also wouldn't lean too close to smell, as your face is not sterile, and anything from the nipples upward, really. Had to smear vapor rub around my nostrils to avoid passing out during a Fernie's gangrene drainage. Even then was white as a sheet and stayed up by doing tension exercises. Surgical nurse was hardcore. It was nothing to her. Not a surgeon. Used to work in a lab. Old people blood and urine smells like old people. I always thought it was cologne or something. The smell of burning flesh from a cautery is probably the worst thing I have ever smelled. First time I smelled it, it made me reconsider all my life choices that led to me to being in that operation theater. I swore I would never become a surgeon and instead get into a non-surgical diagnostic branch. I still put that smell on the top of my cons list when trying to decide what specialty I should choose. Not a surgeon but assisted with surgeries. They smell like blood. And if an operative delivery of a baby, amniotic fluid, which is kind of an indescribable smell. I'm a PA in cardiac surgery. The only thing that smells is when the cautery is burning fat. I think it kind of smells like unflavored Cheetos. Although I might just be so used to it by now that my sense of smell isn't accurate anymore, haha. I work in human allografting. Ground human bone smells just like fritters. Human parts with muscle tissue attached smell similar to raw beef. I don't know whether how live human tissue smells though. Not a surgeon, but soon to be graduating medical student. It really depends on the reason for the surgery. Gut smells poopy, necrotizing and infected tissue smells dank. Otherwise, tissue doesn't have much of a smell. The most potent smell comes from the body knife electric knife cauterizer, cutting through tissue. We must have two different meanings of the word dank. As others have said, electrocautery from the body, instrument used to cut and coagulate, is the most prominent smell. Open heart surgery smells different than abdominal. Smells like pennies taste. The worst smells occur when you're operating on some necrotic or infected body part. Amputations in the setting of terrible vascular disease can be haunting. Plenty of interesting smells when doing colorectal operations. Sometimes you're graced with the presence of butt pus and all its floral notes. Trainee surgeon here. Like most say here, non-infected tissue doesn't smell like anything. You're wearing a mask anyway. Cauterizing tissue releases smoke, which smells like burning hair. I have experienced both. What's more interesting to me is how slippery fat and blood is. Oily slippery stuff that can be a bee to retract. Pull aside. Other thoughts. Men are fat on the inside, women on the outside, and you're making so much harder for the surgeon if you're fat. I assisted once on a multi-organ transplant that took 8 hours and was surprised at how much subcutaneous fat a lady with a BMI of 27.5 had. At the thickest she had a 4-inch layer of fat at her belly. I was assisted in an abdominoplasty where we basically removed some fat rolls off this BMI of 50. Seriously, everyone in the room was curious as to how she could be sexually active attractive. She did have a partner, and freely admitted that part of the reason she wanted the procedure done was easier access to her vagina. We weighed the fat removed and it was 5 kilograms, 11 lbs. According to Broshens, 1 kilogram fat equals 8,000 calories, which means we removed 40,000 calories, or about 10 months of 1,000 calorie deficit day dieting. I'm opposed to the bullying bit of fat shaming. And I understand that not a lot of overweight people actually will go under the knife. But dang, I really don't understand why anyone in a country where food is readily available keeps so much fat on their body. In my college anatomy class we dissected human cadavers. Nothing could have prepared me for the potent smell of Cool Ranch Doritos that smacked me right in the face when the top of the skulls were sawed off. Will not ever eat Cool Ranch Doritos again. Heart surgeon here. It's already been answered, but when you are cauterizing, it smells like really horrible bacon and drilled tooth enamel. In my younger years I got to observe surgeries in farm animals, and I can confirm the blood smells like very strong iron. Burns icunus burnt flesh is the worst I've ever encountered. Add in a heated room and using a diathermy to cut at the dead flesh to prevent compartment syndrome and it's a double whammy. Worst I ever encountered was caring couple of days old burns patient with a leaking stoma bag, poop and burnt skin, and a heated room. An interesting note on this thread, it makes you realize how many other types of people are often present during any given surgery. Surgeons, nurses, anesthesiologists, X-ray techs operating intraoperative fluoroscopy. That was how I got some experience in it, before I moved on to MRI. Representatives of medical equipment, EMG techs, and students of various kinds. All the smells I ever noticed, Generally just the burning, since I was never close enough to smell. More subtle things have been mentioned, but I can remember distinctly when I first started being shocked at how, I can never find the right word for this, but it was a lot like being in an auto repair place, was my first thought. Hammering and clanking. In movies and TV you see people clustered over the patient, presumably doing small, delicate movements. But in orthopedic surgeries especially, there is full-on drilling, hammering, etc. It was a revelation to me. Fascinating. Not a surgeon. I was able to stand in for a CABG, coronary artery bypass graft surgery, during my rotation this semester. I was slightly worried that the smell of burning flesh would be awful, and honestly, didn't smell a dang thing. The only crappy thing about the whole surgery was that it was a total bore. The surgeon had a no noise policy during any of his procedures. Slowest 2 hours of my life. But hey, I got to see someone's sternum get cracked open and look at their heart. Not a surgeon, but I was in the room during my wife's C-section with our second daughter. I remember being really hungry and making the comment, smells like steak, babe. You smell delicious, when they were cauterizing the flesh. The surgeon was not amused. GI bleeds smell like cooked broccoli. Dated a nurse once, and since she told me this, I have never been able to get it out of my head. I used to cut open dead pigs at my old job. The smell of organs. I can't even compare it to anything else. It's not exactly bad, but it's not great. I once worked as a lab tech at UC San Francisco. I dissected and harvested tissue samples from rats that had been treated with different diet drug regimens. Once, doing this, I commented that the inside of a rat smells bad. My boss, an MD PhD scientist, said inside of a human smells worse. Orthopedic surgeries, the only ones I've seen, don't smell at all, unless you use a cauterizer, but any flesh will smell when burned. I've viewed a surgery but not a surgeon. The little clippers that sear wounds as it cuts through you in surgery, they're like what, half a cm long? Every time the doctor clamped it down to cut through some fat or connective tissue, the whole room smelled of strongly burned flesh. That smell never leaves you, and I've only seen 3 surgeries. It's sweet but sickly. Not a surgeon. I'm a morgue tech. Fresh bodies smell like meat, honestly. Sometimes you get a little stomachy smell when you first cut the Y incision, but otherwise it just smells like meat. I work in a vet clinic and have assisted in surgery lots of times. There is a certain smell when you are doing a foreign body exploratory, especially when they cut open the intestine. It's hard to describe. I always get uneasy and want to leave when I smell it. Natural aversion, I guess. Crohn's patient here, with a super candid surgeon. She tried removing a stricture that kept causing obstruction laparoscopically. My guts literally fell apart and she had to cut me open from the titties to the nether regions. It was bad. 30 years of Crohn's will frick you up and make your guts fall apart like paper. I was super curious and she confirmed it smelled like poop, metal, and sour bile. I'm good now, but have short gut syndrome. On a side note, I know it's time to call the GI when my poop smells like old pennies. Fecal blood is no fun. It only smells when it is exposed to oxygen, but if we are going to imagine this, I'd have to go with a smell between liver and blue cheese. No way does it smell like flowers. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.